इसमें होगा। Good morning, sir. I am audible.
Yeah, you
Yes,
are.
sir. Yes, yes.
गोटे ये करछि मोर ये माने प्रेजेंट है से ये
Good morning, sir. This is Sunil Kumar Singh from Delhi Jal Board. I'm director. I'm working in Delhi Jal Board, Delhi government as a director, safety and disaster management, and looking after the responsibility of IT department. And presently, the state nodal welfare officer has appointed me as a nodal officer of the staff welfare cell. So in that capacity, I am delivering this marvelous presentation, having the title Staff Welfare Cell for COVID-19 Officers of Delhi Government. The very basis for formation of this Staff Welfare Cell was that in India, on the first lockdown was started on 24th March of 2020 for a period of 21 days. The very purpose was to lifting the movement of entire 1.3 billion populations of India as a preventive measures to jot down the spread of COVID-19 pandemic. The first lockdown process was commenced on 24th March 2020, and the second one was on 15th of April 2020. The third lockdown was commenced on 4th May 2020, and the fifth one was and the last was commenced on 18th May 2020. During the lockdown procedure, during the lockdown period, Delhi government officials, Delhi government officials, corporations officials, local bodies officials, autonomous bodies officials, all are working under the banner of Delhi government, have deputed for the service of citizen of populace of city Delhi, for rationing work, for sanitization work, for other support kind of thing, for transporting the laborers from Delhi to their native village or destination points. So so during these procedures, many of the Delhi government officials were infected with the COVID, and their family was put on a stress. They were afraid from trauma, and since the COVID pandemic was on the very high stake, so they were very afraid, and they went to mental trauma. Numbers of cases were when brought to the notice of the Honorable Lieutenant Governor Delhi and the Chief Secretary Delhi. They pondered upon the situations, and they thought that why don't we go for an institution of staff welfare cell for the welfare of the COVID officials and their family. So they on 2nd of May, during the second lockdown, on the 2nd of May, they started, they constituted a staff welfare cell for COVID patient. A order was issued under the signature of Chief Secretary Delhi, Honorable Vijay Dev Sahab. So that is the beginning of this staff welfare cell. So on the direction of Delhi government, a staff welfare cell was instituted for infected officials, and on 4th May, this staff welfare cell was instituted and brought to the function. The staff welfare cell covers the officers of Delhi government, MCDs, I mean corporations, local bodies, so many local bodies and autonomous bodies. During and still the staff welfare cell is working and extending the support and services to the COVID infected officials of Delhi government. So far, the present tally is concerned, I think in the presentation, so we have brought down 1,000 COVID-19 affected officials, but the tallies has crossed above and escalated to the figure of 1,100. So we have monitored and extended the care and support of around 1,100 COVID infected officials of Delhi government. Patients daily, we are following the daily patients and this cell is 24 by 7 operative and maintaining a daily interactions with the health department, hospital authorities, CAT and ambulance, all 11 district magistrates, chief district medical officers, district surveillance officer to resolve the patient's concern. On the commencement of this staff welfare cell, this Mr. Paras Singh of Times of India Group had published this beautiful news coverages that have having a sticker and details of the staff welfare cell and the relevant helpline numbers covering I mean, 2-3 landlines and the mobile numbers. So the entire process and working of this COVID welfare cell, this news clippings has covered. See, this is a pictorial depictions of the COVID-19, I mean, staff welfare cell. It is operative 24 by 7 at Delhi Zal Board headquarters. Since Nikhil Kumar, Mr. Nikhil Kumar is the state nodal welfare officers and he is the Secretary Environment and Secretary Flood and Irrigation Department and the CEO of Delhi Zal Board. So he preferred to utilize the space and ministerial services of Delhi Jal Board. So in 24 hours from the date of the issue of the order from Chief Secretary Delhi, we have instituted this COVID 24 by 7 helpline. So this is the our staff, ministerial staff. They are well educated and they are working 24 by 7 in 3 shifts. Next. Since it was a date on the 2nd of the May, this Chief Secretary Delhi had issued the order. So only Sunday was there. So it was very difficult to meet out with the expectation of the Delhi government and the Honorable Lieutenant Governor and Chief Secretary Delhi, but somehow we had managed the show. So these were the challenges, I mean, 4 challenges I experienced while instituting this COVID staff welfare cell. So one was related to the shortage of time to establish SWC and made to operational. Scarcity of ministerial staff and to train them is the second challenge, because you know that in a government department, the staffs are very limited and they are retiring on a day-to-day basis. Third part is that how to made to functional. So documentation part was important, and issue of circulars, orders was very important, because the purpose is to gather the information from every of the organizations of Delhi government. So we had issued orders to all the government officials, just that to know, to aware them that yes, the staff welfare cell has instituted and it is purposely designed and devised for the redressal of the problems of the COVID related problems of the Delhi government, local bodies, corporations and other government institutions. And meanwhile, it was a challenges that to develop the communications tool, because the communication tool is more important to receive the data from various sources and to disseminate the data to other sources and to the patients and to the other offices. For process followed for implementation of this staff welfare cell was that nodal officers were appointed. I mean, we have 10 to 12 officers of the gazetted rank who have been appointed as a nodal officers, and their work was allocated on requirement basis that one is to set up a staff welfare cell to train them, officials who are working 24/7 basis, to provide the data, to set up a helpline, so to create email communications and WhatsApp groups to receive the data and to disseminate the data, vice versa. Training was one of the important tool that was required and felt needed to provide to the officials who are handling with the helpline numbers. Uh, for process applications, patient checklist was designed. Model questionnaires were designed while interacting with the COVID infected officials. So call logs were designed. Patient checklists were designed. And it was important that the all COVID infected officials were quarantined. If they don't have limited, if they don't have enough space, then they'll have to send to the quarantine center and provide all moral supports and psychological counseling to the officials, infected officials, and their families as well, ensuring the other foremost achievement of this staff welfare cell is that while interacting with the COVID-19 officials from morning 10 a.m. to up to 2 p.m. Each officials have been inquired upon that if they have a requirement of food, if they have a requirement of medicines, while making regular interactions with the patients to know their health status and the problems what they faced upon. Helpline is also providing the contact details of local medical officers for treatment, test, and medical assistance. Because if they want to have a test of their family members, then we are providing the test facility also. We are also providing the contact details of the CDMO and the DSO of their respective districts. So the purpose is to make a one-to-one interactions with the local health department, local doctors, and the patient. So during the quarantine period of 14 or 17 days, they can have interactions and they can set the queries.
Please conclude in 2 minutes, sir.
Yeah. Innovative aspects of project activity is to maintain a sharp focus on the task assigned. The principal secretary health was requested to nominate a senior officer for assistance, and so they had provided a very senior officers for the support and assistance. So this way the Delhi state government has provided all the necessary help and support. Next. See the pictorial view that Japanese sanitization machine was there. We had provided, and the sanitization process is on the way. We had the CATS ambulance. The psychological counselors has reached down to Delhi Dehat areas from the Ehbas to provide the support. On the receipt of the calls, we have started registrations of the COVID infected officials. Daily monitoring is started. During the interactions, we have inquiring about their health, food status. We are sending ASA workers, medical assistance, hospital admission, ambulance, oximeter, COVID test, quarantine arrangement, psychological counseling, and inquiring about the status of the patient who have been admitted in the hospitals, and getting interacted with their family members, and knowing, providing their status that yes, your parent or their guardian is there, and they are in the good recovery mode. So standing operating procedures were also designed and brought to the practices. The targeted population is all officers of Delhi government, autonomous bodies, corporations, and local bodies. Before pre-deployment, the restlessness was there, fear, trauma was there among the officers of Delhi government and their family members that how to handle the situation and to whom they should contact for the help. But after, but the government has taken cognizance of this trauma, and SWC was instituted and it was brought to on effect on 4th May of 2020. And sir, I'm submitting the data that around more than 835 officers have been recovered from this virus and joined back to the offices. And the other thing is that awareness among other are there that the state government is providing support to its officials and family. These are the stickers we have provided to all the government officials. And the replicability of arising from success of activities that on Delhi model, SW should be created in other states for the welfare of the state government and their employee to cope up with the pandemic situations. So these are the helpline numbers, mobile numbers, and other details. The one statistic is there that the total registered cases in SWC is 1080. Now it has now the today's tally is 1101, and the active cases in the present is 238. Recovered 877 in the presentation 826. So it has escalated to 877, and the death is 16. So 1.5% is the death, and recovery is 76.5%, and the active cases is 238 numbers, in percentage 22%. So this is the efforts and achievements whatever been provided by the staff welfare cell to the COVID patients, COVID officers of Delhi, COVID officers of Delhi government. And we are still, the staff welfare cell is working 24/7 and receiving the data, daily follow-up being carried out. We are monitoring on one-to-one basis. And in case of requirement of ambulance, we are providing the services from CAT. We are providing the quarantine facilities in the hotels and in the quarantine centers, and medical supports, test supports, and food, medicines, rations, whatever they fail to, we are providing.
I think you need to conclude, please.
So I've concluded, sir, and need your blessings from the juries that boost our staff welfare cell, because it's the working for the noble causes for the officials of Delhi government. Thank you very much.
Thank you. Gupta ji, you will like to ask, please, first?
I have a question, particularly for staff or people who have died due to COVID. Are there any compensation package provided by the state government to these people or their families?
Yes, sir. On the onset of this pandemic, the matter was brought to the notice of Honorable Chief Minister and the Lieutenant Governor that people who are, since some utility services as they are like corporations, Delhi Jal Board and the Transcos and other electricity department. So on the government job and on the duty, most of the officers get infected, and a few had lost their life. So Delhi government had announced rupees 1 crore for compensation as a express year. So when the case has come to the notice of this staff welfare cell, and we are monitoring it, and in the meanwhile the people lost their lives. So we had prepared a file and forwarded to with all recommendations of the state welfare officer, Mr. Nikhil Kumar, to the Honorable Chief Minister for the this grant, for issue of the grant of their families.
But the grants have not yet started.
No. Grants are under consideration, and lots of headway have been there. And if the government has announced it and made to the public notice, and and we have prepared the file with all recommendations along with coupling with all the documents required. So it is likely to.
Why I am worried is that
sir.
A similar announcement was made by central government for the health workers.
Yes, sir.
And now the central government says they don't have any data for providing
Sir,
them the compensation.
sir,
So
sir.
I am only worried that the same thing doesn't happen in the state
No, no.
government also.
It is on record that Delhi government has granted, a few doctors and the health workers 1 crore rupees, and
Okay.
it is in the knowledge of everyone of the city of populace of city Delhi. It is made to the notice of everyone and circulated through the newspaper articles also, that the Delhi government has provided a sum of rupees 1 crore to few doctors and the ASA workers.
That were actually just 2 or 3 cases which came in the limelight, I think. But for the general officials at the lower rank who
Sir.
are, say,
Sir, as
safai
far as
workers.
Sir, we have forwarded 7 cases of this type to the government, and basically the grant has to be sanctioned finally
Yes.
through the pen of Honorable Lieutenant Governor. So it may
There are only 16 cases as per your record. There are only 16 such cases
only
in
16
the state.
cases.
Only
Yes,
16
only
such
16
cases.
cases. Yes, sir. If you go to the statistics, you see that only 16 cases of death are there.
Yes.
Have been registered with the SWC, and in the percentage it is number of 1.5%. The recovery rate is 76.5%, and the people
But that
who
is
were infected,
that is less than the total recovery rate of Delhi. 76% is less than
76.
the average recovery rate of Delhi. Delhi's average recovery rate is more than 83%.
Yes, sir.
Whereas
Basically,
for the staff it is only 73 or 75%. So staff recovery is lower.
sir, especially those cases which have been registered in SWC, we are having a data for that. As far as the Delhi peoples who have been infected during this period is different, and our cases is different.
Now,
Uh,
a little related question: out of
sir,
these 16 deaths, how many
sir,
are actually employees and how many are their family members? Is
no,
there
no,
any
sir.
data on that?
Sir, we have a data and clear data. Fair understanding is that total 16 government officials have
No, because
lost their
the
lives.
total this cell was for their family members as well as for the
Sir,
officials.
yes, sir. I can understand that this cell has been
So,
devised for the welfare of the officers, and their family members. But the death is
and the
the
family, and
no,
death
sir.
is only of the
Government officials, sir. No,
only
no.
government officials.
Yeah,
No,
sir. No
no
family
family
member.
member has died.
No family members have died,
Okay,
sir.
okay,
See,
good. Thank you.
And the statistics also shows that those people who are on the superannuations likely to be superannuated, they are nearing to the retirement due to age problem, due to their weakness and some other diseases. They have lost their life.
okay,
Though we are
Mr.
That may
able
be
to,
associated.
sir,
Gupta ji, you have to complete. You
sir,
Yes, I
complete?
have completed.
Okay. Now,
Thank
my
you.
just a small thing. Tell
sir,
me why Jal Board has been given this responsibility?
sir. It's
Very
a
short.
very yes, sir. It's a very important question, sir. In Delhi Jal Board, in Delhi government, Delhi Jal Board is a biggest organization with the Delhi. Delhi Jal Board is the biggest organization of Delhi government, because initially MCD was there, but on the trifurcation of the MCD, so they had trifurcated into 3 individual units. So Delhi Jal Board is a huge department having more than 20,000 of officials. And the second question is, sir, that Mr. Nikhil Kumar has been made responsible for the state nodal welfare officer, and currently he is the CEO of Delhi Jal Board and the secretary of flood and irrigation. So this cell was instituted in Delhi Jal Board because we have a space and the staff.
Okay, I think police is not covered under only.
Police is not covered, sir. Yes, police is not covered in
What
Delhi.
about, you see, if an official of another department
Sir,
gets COVID is positive, you are there to take care of him. What about his own department? Do they also take care, or is it duplication, or is it only you are doing?
sir, only as per the mandate of the order of Chief Secretary, only a staff welfare cell is responsible to extend the all support. The fact is that every government offices have been its own one nodal officer. So all the departments have their independent nodal officer for the COVID purpose. They collect the data, they provide the information to the staff welfare cell, either through the email, through the WhatsApp, through the or helpline numbers, and we subsequent to the receipt of the information from the respective nodal officer, SWC is registering the cases in the patient checklist and the call logs, and since their monitoring is start on one-to-one basis, and the whatever the whatever the information asked for from the SWC, we are dedicated to provide the details.
Okay, last question. What more you think is need to be done to improve your working and efficiency? Because as you said, death rate is quite high if you take the Delhi average as such. So any steps you have in mind?
Sir, the question is very valid because to enhance the efficiency of this SWC, we had written a few requests to the health department and to the honorable LG sir to provide some officers from medical side to provide some psychological counselors and to increase the dedicated hospitals and test laboratory for this purpose, so that we can have a one-to-one solutions depending upon the patient's requirement. Though the CATS ambulance are providing these services, best services, and hotels are there, quarantine centers are there, but we are also painting the situations before the honorable LG and the honorable Chief Secretary that some senior officers must be deputed for the redressal of the grievances of the patient and their respective family members, and psychological numbers of psychological counselors need to be escalated, because in family, if suppose one government officer have infected, their family also went to some trauma. Okay. So some these escalations. Thank you, sir, for your patient hearing and supporting this staff welfare cell, and we certainly need your blessings for its escalations in the day.
Thank you, sir. Thank you.